let's talk about something truly terrifying, a scenario that can unfold in a place we're supposed to feel safest, the operating room. We're going to dive into what happens when a surgery is called a success, but the patient wakes up to a life-changing injury that maybe, just maybe, should never have happened.
Just imagine this for a second. You're coming to in the recovery room. The surgeon walks in, all smiles, tells you the procedure went perfectly. But as the fog of anesthesia starts to lift, you realize something is deeply wrong. You can't feel your arm, or maybe your foot just won't move. So, what on earth happened? That's the mystery we're unpacking today.
And here's the wild part. The cause of this sudden paralysis, it often has absolutely nothing to do with the scalpel or the surgery itself. Nope, it's all about how your body was positioned and whether it was protected while you were completely unconscious on that operating table.
Okay, so let's put ourselves in the patient's shoes. Think about that moment of realization, when the pure relief of getting through surgery is suddenly swallowed up by a whole new kind of fear.
Yeah, this quote just hits you, right? It perfectly captures that jarring disconnect. On one side, you have this declared medical victory, but on the other, a personal disaster is just beginning. It's that exact contradiction that kicks off this whole investigation.
So how does something like this even happen? Well, to get it, you have to think of the operating room as a kind of black box. You, the patient, you go in, you're put to sleep, and you are completely and totally vulnerable. You have zero memory of what happens until you wake up. Think about it. When you're awake, right? If your arm falls asleep, you get that pins and needles feeling. It's your body's alarm system screaming, "Hey, move!" But under general anesthesia, that entire alarm system is shut off, completely silent. You can't feel the warning signs, and you definitely can't move to fix it. And because you are so helpless, this huge responsibility, what's legally and medically known as the standard of care, it shifts entirely to the surgical team. They have, and this is not an exaggeration, a sacred trust to carefully align your body, pad your joints, and make absolutely sure your limbs aren't being compressed or stretched for hours at a time.
Now, when that trust gets broken, the evidence isn't just a vague feeling of numbness. It's a specific physical injury. And these injuries, they're like clues, breadcrumbs, that point directly back to what went wrong inside that black box.
Take a look at this. These are the three classic types of positioning injuries. First, you've got claw hand. This comes from the ulnar nerve getting crushed, often because someone was literally leaning on an unpadded elbow. Then there's dead arm, a brachial plexus injury, which can happen if an arm is stretched way back at an extreme angle. And finally, foot drop. That's the peroneal nerve getting compressed, something that can happen in surgeries that use stirrups. Now, it's really easy to just point the finger at the surgeon, right? But that's almost never the whole story. In cases like these, the responsibility is almost always shared among the entire team that was in that room.
And this chart breaks it down perfectly. You see, while the surgeon is laser-focused on the operation, it's generally the anesthesia provider who's responsible for your head, neck, and upper body. And the OR nursing staff, they're the ones who are supposed to grab the right padding and keep an eye on your limbs during the entire surgery. It's a total team effort, which means a failure can come from a bunch of different places.
As you can imagine, when an injury like this happens, the hospital usually has some go-to explanations ready. So let's break down a couple of their common defense tactics, their alibis, if you will, and what the reality actually is.
Oh yeah, this is a big one. They'll tell you that you signed a consent form, and on that form, it mentioned nerve damage as a possible risk. It's designed to make you feel like you've got nowhere to go.
But, and this is so important, here's the thing you have to understand. A consent form covers the inherent risks of a surgery, like say a nerve that's right next to a tumor getting bumped. It is not a get-out-of-jail-free card for preventable carelessness. You did not consent to someone just forgetting to put a simple cushion under your elbow. That's negligence.
All right, here's another one they might try. They'll try to shift the blame onto your own health. They might suggest that because you have diabetes, for example, your nerves were just more fragile and, it was bound to happen. But the reality is the complete opposite. Legally, if a patient has a condition that makes them more vulnerable, the surgical team actually has a higher duty of care. Your vulnerability isn't an excuse for them to be careless. It's the reason they needed to be even more careful.
So let's get down to it. If you were unconscious, and the team has their own story, how do you ever prove what really happened? This is where we find the smoking gun hidden deep inside the operating room's black box.
The key, it turns out, is in the hidden records.
These are the documents that patients almost never see. We're not talking about that simple one-page note from the surgeon that just says, "Success." We're talking about these super detailed, minute-by-minute logs of everything that happened.
And this is exactly how the mystery gets solved. Investigators get a hold of records like the anesthesia flow sheets. These are digital logs of your positioning and vital signs, and the intraoperative nursing notes. These documents show exactly what kind of padding was used, if and when someone checked your circulation, and how your body was positioned from one minute to the next. Any gaps or weird entries in those logs, well, that's often where you find the real story.
You know, when you really think about it, this all comes down to one fundamental question. We place our absolute total trust in the hands of the surgical team. And this peek inside the black box is a really powerful reminder to ask, when we are at our most vulnerable, when we are completely helpless, who is truly watching over us?